Well, Dr. Bharat Pankhania joins me for more on this. He's a senior clinical lecturer at the University of Exeter's Medical School. Dr. Bharat, thank you so much, as always, for joining us on the programme. Just listening to some of those statistics, a disease that kills more than 400,000 people each year. Why has malaria been so difficult to eradicate?
It's a complex infection because the mosquito that introduces the plasmodium then has a cycle in the human body itself. And because it is a parasite compared to a virus or a bacteria, it is that much more difficult to control and treat malaria. It is a very complex infection, but this is a step in the right direction with the deployment of vaccines.
Is it a breakthrough? Because I read only 30% effective, 4 doses are needed, and protection fades after several months. Is that still a good outcome for the millions of people around the world at risk?
It's a start, and I'm smiling, and the reason why I'm smiling is once the mRNA vaccines deployed for Ebola and SARS-CoV-2 were found to be successful, I feel that the next step will also be the deployment of mRNA vaccines to make a better malaria vaccine in time. I'm not casting doubt on the current RTS-S vaccine developed by GlaxoSmithKline. It's as good as can be at 30% effectiveness, 40% protection. It is low numbers, and of course, as you correctly say, 4 doses to be given earlier on in Africa. So there are hurdles to be encountered, but it is a step in the right direction.
I mean, even at 30% effective, I mean, just explain to us what this vaccine will mean to millions of people around the world, in countries in Africa, in Asia, Central and South America. How will it improve their lives, especially for young children?
So this is a vaccine against one type of malaria, falciparum malaria. So it will predominantly be deployed in Africa, where we have more of the falciparum malaria. And how the vaccine works is it acts earlier on in an infection, interfering and creating immunity against a protein that the early infection produces in human beings. Having said that, although it is only 30% effective and the immunity wanes very quickly, we feel it will save many children's lives, because it is these little children, little babies under 5-year-olds who get infected a couple of weeks later, severe fever, and many of them get falciparum malaria, cerebral malaria, I meant to say, and they die. So those children's lives, not all of them, but many of them, I expect will be saved. And as the WHO Director General said, it is a multi-pronged attack. So you don't give up on your mosquito nets, removing water puddles everywhere, taking antimalarials, and taking the vaccine. When you do all those measures, I think it will be pretty effective in reducing some deaths, not all.
But I guess the point being that it might stop people swamping the health system in some of these poorer countries. Is it a disease that only affects the poorer countries?
No, it affects wherever the mosquitoes thrive, and wherever the falciparum parasite-carrying mosquitoes live, you will get malaria. And together with malaria, by the way, is also another serious infection called dengue. And dengue, malaria often go together in these poorer countries where you have mosquitoes and warm temperatures.
I guess like the corona vaccines, if it's reducing hospitalizations, whilst not possibly reducing the transmission, it will still help. I believe you yourself have been suffering from COVID, is that right? How are you faring?
Yes, and I'm a clear example of vaccines save lives. So I have been fully vaccinated against COVID, and I got COVID, and I have been ill. But I'm so grateful that the vaccines have stopped me from getting severe illness, that COVID, pneumonia, and maybe being admitted to hospital, that sort of thing. So again, I say to our listeners and viewers, please get yourself immunized. The vaccines will save your lives.
Yeah, a huge step forward. That's having a major impact on millions of people's lives, including yours. We do wish you well, Dr. Bharat. Thanks so much for always joining us on the programme.